Aubrey Shomo. If you would state your name and who you recommend, or who you represent. I'll be all right. I was up till midnight last night. So.
Thank you, Madam Chair. I am Aubrey Ellen Shomo. I represent a newly formed group calling itself the Mental Patients Anti-Defamation Alliance, which is an organization of survivors of coercive psychiatric practices organizing in order to more effectively and more meaningfully assert the rights that all citizens enjoy. My comments were originally prepared for the bill as drafted. I will deliver them as I intended, and then I will add a note with respect to the amendments that we received this morning. I've chosen to tell you guys a personal story, a story of a complaint that would be barred by this legislation. When I was a kid, I was subjected to physical, sexual, and medical abuse in the form of Munchausen's by proxy by my mother. This resulted in a significant and long-durated history of mental health treatment, beginning when I was 8 years old. Prior to that time, instead of being in mental health treatment, I was in educational programs as a prodigy. When I was 14 years old, I was reporting the abuse. I clearly communicated I was being sexually abused. I expressly in words communicated I was being physically abused. And I reported the Munchausen's by proxy and the fact that lies were being told to have treatment delivered upon me against my will. Despite this fact, through the Department of Human Services of the state of Colorado in Boulder County and a team known as the Family and Community Team, and most directly by an individual in the person of Mr. Danny James, I'm sorry, I don't know his middle name, but Mr. Danny Shearer, these abuse reports were ignored. For 3 years, the abuse went on, while I was managed by all of the available forceful means of the mental health system, which included the threatened use of state power upon me. Eventually, 3 years into this episode of abuse, into this childhood, I defended myself from an abusive parent. This was after an incident where the parent was caught red-handed abusing me in front of a witness, my brother. The police were dissuaded from arresting my mother by Mr. Danny Shearer. Some months later, I acted in my own defense. I acted lawfully. I was backed into a corner in my room, no retreat. My mother was coming at me to do no one knows what. I had already been assaulted. I had bite marks and scratches from my defensive posture as it was stripped from me, and I stopped her. I was promptly arrested because it had already been explained to the police that I had a mental illness and needed treatment. When the case was brought before the court, Mr. Shearer explained to me that if I did not accept a plea agreement as presented, being trapped with my mother, that additional lies by my mother would be told, which would result in additional forcible treatment. I was coerced as a juvenile into accepting a plea agreement in open court that I did not wish to do. I wished to go to trial, but I was being maintained in that home against my will by a provider with knowledge of the abuse. My initial interactions with that provider were in 1999. The incident for which I was charged was in July of 2001. The plea agreement was negotiated by the fact team and specifically by Mr. Danny Shearer, though he names other individuals as having been involved. It was neither negotiated nor requested by me. That document was executed on September the 10th of 2001. On September the 12th of 2001, the day of the scheduled arraignment, I called up Mr. Shearer, and I begged him not to make me enter that plea. I thought perhaps recent events would dissuade him from depriving me of my civil liberties. Mr. Shearer arranged for the agreement to be made more harsh in response. I went to court and I did as I was told. There is no mechanism available at law to undo that because of the specifics of the agreement Mr. Shearer negotiated. For years, a year after that, I was trapped in my mother's home, trapped in the physical and sexual abuse. For years after that, I woke up screaming. Nightmares, dreams, powerlessness, fear. I couldn't come forward, even though I knew what had been done. Time went on. I asked Mr. Shearer to come forward. He refused. Eventually, 10 years later, on April 28, 2011, I spoke to Mr. Shearer at his office with his consent. Unlike the prior times I asked him to come forward, this time I got smart. I wore 2 independent wire recording devices. I tagged the tape for admissibility in court, and I asked questions. The result of that conversation is the proof that the plea agreement was negotiated by others, that I didn't want it, and that Mr. Shearer was aware I was reporting at least the physical abuse, aware of the bite marks, and aware of the fact that I was being subjected to Munchausen's by proxy. On this tape, Mr. Shearer admitted to the threats he used to secure the plea agreement, specifically the actions my mother would take if I sought to go to trial while I was trapped in her home. That was 10 years after the acts, and the acts were discovered during their commission as they took place on me. I would not have been able to safely come forward prior to that time. The wire recording is the only means of protection I have from a provider who harmed me. The result of coming forward is that an investigation is underway into Mr. Shearer and the individuals he names as complicit in his actions. That investigation will likely result in a number of additional filings with DORA based on the extent of the actions which are provable. And that investigation was made possible by the fact that the Mental Health Center of Boulder County retained their records beyond the statutorily mandated time after my 18th birthday. Had those records not still existed, I would be without hope. DORA, for the most part, places the burden on the accuser. And it is only through the fact that there was sufficient evidence left that any progress has been made. That ongoing investigation continues. But not only was I traumatized, I was afraid. I was a mental patient, and Mr. Shearer had incredible levels of power over me. It was made clear to me by him that no one would believe me. He says this on the tape, and I remind this committee that every member of it has a copy of that tape, and this entire Congress has a copy of that tape, as well as a stenographed transcript thereof. More recently, in response to posts on the internet, in a forum of independent editorial control, Mr. Shearer had me arrested, allegedly for harassment. I informed Mr. Shearer that I was credible to the state and that I had the intention to file an ethics complaint, which, ladies and gentlemen, I still haven't done. The Office of Behavioral Health filed the ethics complaint because I still have trouble writing it up. I spent the night in jail. I was made to face the wall with armed men behind me. I was put in a striped uniform. Because mental health providers are credible and mental health clients aren't. No one even bothered to look at the evidence in that, but the investigation was already well underway. People are afraid of retaliation. They are afraid of sanction for speaking up. They fear being punished for reporting their providers, and that's on top of the trauma of the original experience which keeps you from coming forward. This isn't about small business owners. In my case, this is about the very integrity of the rule of law. And this committee, in response to a previous bill, has heard testimony that such caseworkers may have 35 children on their plate at a time. Those children, those other kids who would never dare speak up because they are afraid, may have a chance, but only if the complaints which result from the current and ongoing investigation are not time-barred. If this bill passes now as drafted, those complaints will be blocked. Justice for those children will be blocked, and the family and community team frequently managed homes in which abuse was present. This limitation is a discriminatory barrier against mental health clients. DORA already weighs the available evidence, and the burden is on the complainant. The amendment is some improvement, but it is not sufficient improvement. Already, it's a question of whether the records exist. Already, it's a question of whether there's proof. The amendment seeks to limit it to persons over the age of 18, but you don't have to be a minor to be subjected to the stick of state. Mental health providers frequently use legal mechanisms to secure treatment against people's will. And if they do so inappropriately, sometimes the criminal statute is run. In the case of Mr. Shearer, the only available statute is federal. The civil statute has run, though recent retaliation may renew it. DORA, however, is not tasked with punishing individuals who have committed misdeeds. DORA is tasked with protecting the community from individuals who violate the sacred trust of their licensure and power. Sometimes these individuals escape detection for years, sometimes decades. In my own case, Mr. Shearer gives details of at least one other case in which he claims he did about the same thing. And there are almost certainly countless other cases. Mr. Danny Shearer is a danger to his profession and to the community, and a danger to the rule of law. And he names a number of other individuals. If the individuals he named were complicit, there may also be an issue. In one of his last messages to me, in his voice, he uses the following words: "We're not worried," with respect to his misconduct coming to light. The reason he's not worried is very simple and very straightforward. It's already next to impossible to get a DORA complaint to track. It's already next to impossible to get a complaint to take hold. Only through a plurality of complaints from a plurality of victims, or an investigation which identifies that, is an individual's license in true jeopardy. And that is sometimes only possible well after the fact. But despite the age of the complaint, it's about the future. It's about the kids that are probably getting hurt right now. And for that reason, not only the discriminatory reasons, but the protection of children, the saving of lives, it is inappropriate to add this barrier. Thank you, Madam Chair.
Thank you very much for your testimony and for sharing your story. Are there any questions for our witness? Okay, seeing none, thank you.